Senator from Illinois.
Madam President, let me thank my colleague, the senior senator from the state of Georgia, for joining me in this bipartisan effort. As he mentioned, we now have some 36 sponsors and co-sponsors of this legislation. Immigration can be a divisive issue, but this is an immigration measure that is not divisive. It is unifying us on a bipartisan basis, as it should. We are talking about the Healthcare Workforce Resilience Act. We are talking about men and women who, as we speak on the floor of the Senate in the safety of this chamber, are literally risking their lives as healthcare professionals across the United States dealing with this pandemic, which we fight every single day. Last week, we sent a bipartisan letter urging congressional leaders to make this bill part of any COVID-19 relief legislation currently pending before the Senate is a negotiation with the White House, the House, the Senate, Democrats and Republicans, to make sure that we continue to move forward to fight this pandemic and to restore the vibrancy of our own economy. The letter we sent was co-signed by Senators Leahy, Young, and Coons, as well as Congressman Schneider, Cole, Finkenauer, and Bacon, who are the lead sponsors of the House version of the same bill. We are now up to, I understand, 37. I said 36 earlier. I'm told we have 18 Republicans and 19 Democrats, and the window's open for those who want to join us in this bipartisan effort. They won't regret it. Our bill is a temporary stopgap measure, but it's designed to strengthen our healthcare workforce and improve healthcare access for Americans in the midst of this crisis. Consider this reality when it comes to fighting the COVID-19 virus. 1 in 6 healthcare and social workers in the United States, 3.1 million, 1 in 6, of the 18.7 million are immigrants. And yet our broken immigration laws prevent many of these immigrants from contributing more fully to the battle against this pandemic. Under current law, there are not enough immigrant visas, which we also call green cards, available each year. As a result, immigrants are stuck in crippling backlogs for many, many years. The green card backlog, which I have debated with Senator Lee on the floor many times, but this green card backlog includes thousands of medical doctors currently working in our country on temporary visas. This backlog puts them and their families at the risk of losing their immigration status and being deported. And it hinders their ability to fight against COVID-19 because these doctors face many restrictions due to their temporary status. For example, many of these doctors cannot take shifts at hospitals in COVID-19 hotspots where they are desperately needed. Now, the Healthcare Workforce Resilience Act, which we bring to the floor, would reallocate 25,000 unused immigrant visas for nurses and 15,000 unused immigrant visas for doctors. These are visas Congress has previously authorized but were never used. It is important to note that our bill requires employers to attest that immigrants from overseas who receive these visas do not displace the employment of any American workers. We want to ensure the beneficiaries of this bill complement, not replace, the American healthcare workforce. I'm going to tell you the story of one of these doctors who is practicing in downstate Illinois in the Quad Cities area in Moline. I can tell you as a downstater myself, there are many areas of downstate which are rural, small town, and cannot bring in the specialists that are needed. That's why these doctors become so important when they step in and provide their services. Let me tell you about this doctor. His name is Dr. Banu Vakalanka. He sent me a letter and told me his story, and he asked me to help work to pass this piece of legislation. Dr. Vakalanka and his wife, Dr. Sasi Royuru, excuse me for mispronouncing, Royuru, are both physicians. They met in medical school in India, and they came to the United States 15 years ago in 2005, 15 years ago. At the time, their children, a young boy and girl, were 5 and 3 years old. Before they came to the United States, they had trained and worked for 10 years in England. Both achieved great professional success. But they were drawn to move to the United States. They were drawn to our freedom, our equality, and the opportunity that really is our trademark in the world. This is what Dr. Vakalanka told me about his family's move to the United States, and I want to quote his words. "It was not an easy transition," he wrote. "We had to start all over again as residents. It was challenging to take care of 2 young children in the middle of our long working hours and paltry salaries with no one to fall back on. But we had not come this far to give up on our dreams easily." Dr. Vakalanka now works as a medical oncologist for the Unity Point Health System in Moline, in my home state of Illinois, a well-respected institution. Dr. Royuru is a family physician in Bloomington, Illinois. There's a long drive between the two, Moline and Bloomington. Here's what Dr. Vakalanka told me about his life in America. "Despite the initial hardship, we fell in love with the United States soon after we came here. People were welcoming and generous. We were made to feel like we were part of this society from day one, and we felt that this is where we belong. We felt blessed, happy, and proud to be able to live here, raise our children, and call it our home." Let me tell you, he tells me how fortunate he was. I believe we are the fortunate ones. Fortunate to have 2 exceptional physicians and their children as residents of my home state. Unfortunately, Dr. Vakalanka and his wife, Dr. Royuru, are 2 of thousands of doctors who were stuck in a bureaucratic backlog called the green card backlog. They've lived in the United States for 15 years. Their green card petitions were approved nearly a decade ago, and yet even today, after more than 10 years, they are not lawful residents. Why? Because the backlog of people seeking these green cards, these immigration visas, is so large. In the midst of the COVID-19 pandemic, the temporary immigration status of this family puts them at real risk. Why? If, God forbid, they would contract COVID-19 and become disabled or die, their family would instantly lose their immigration status and be forced to leave the United States. 15 years they've waited. 10 years they've been on the actual queue, the waiting list for green cards. And if one of them takes ill and cannot work, they could all be deported. Now their children, who were 5 and 3 when they arrived in the United States, are 20 years old and 18 years old. This is significant. They grew up in this country, but they're at the risk of aging out in this bureaucratic system. If they reach the age of 21, these 2 children who have lived here virtually all of their teenage and adolescent life, if they reach the age of 21 and have not received a green card, they are subject to deportation. Can you imagine how devastating it would be for this doctor and his wife to think that their children, after all these years, would be deported from the United States? It is a very real risk. Dr. Vakalanka told me, and I quote, "Our children waited for 15 years or longer, along with us, for their turn. They laughed with us and cried with us for all these years. It is not fair to kick them out of line through no fault of their own. They have nowhere else to go. This country is their home, their only home." Dr. Vakalanka and Dr. Royuru's family story makes it clear why Congress needs to include the Healthcare Workforce Resilience Act in the next coronavirus relief legislation. Under our bill, these 2 good doctors from India and thousands of others like them would finally receive their green cards. They and their families would get the permanent immigration status they deserve and be able to use their skills to serve on the front lines of the pandemic wherever they have needed most. Let's face it, this pandemic is testing us as a nation, testing us as to whether we or not have the endurance and the determination to get through this pandemic, but equally testing us as to whether or not we care for one another. Certainly we care for our families. We spend a lot of time with them. We worry about not being able to be next to our children or grandchildren because of fear of infection. And it's a real test, but it's also a test of our values of who we are. This man, after giving 15 years to the United States, practicing medicine in areas where he is desperately needed, is simply asking for a chance to become a citizen of this country, a legal permanent resident of the United States. It's not too much to ask. For all he has given us, and his wife as well, we owe it to him and his family to give them the peace of mind that they have a future in the United States. They have proven that they're deserving. I hope that even in these divided political times, we can come together in Congress to quickly aid these immigrant health heroes. I commend my colleague from Georgia. I thank him. He had to step away from the floor at this moment. But I thank him for joining me in this bipartisan effort. Let's get this done. Let's do the right thing for this doctor, for his family, and for so many others.